blend. Ladies, it is a problem many of you will experience as we age. We're talking about fibroids. This morning, we're focusing on what uterine fibroids are and the treatment options. And here with more is Dr. Lamar Tyler, an OBGYN with Well Health Women's Specialty Care. Good morning, and not only welcome here to the show, but welcome to Vegas.
Well,
You're new to town.
Thank you. I'm very happy to be here.
Yes.
I'm loving it so far.
How is your day going?
So far, so good. I start off with a very early morning delivery at 4 o'clock this morning.
Crazy?
So I hope I got enough beauty sleep to do well here today.
Yes, welcoming new life into the world, right?
Absolutely.
That's so
It's
cool.
an adrenaline rush for sure.
Yes. Okay, well, let's talk about uterine fibroids. What are they exactly?
Fibroids are benign, non-cancerous growths of the uterine muscle. The formal medical term for fibroids is referred to as leiomyomas or myomas. The myometrium is the muscle layer of the uterus, and it appears that the cells in the myometrium start to divide irregularly, forming a firm ball-like growth of the uterus.
Okay.
These growths can have variable growth rates, and they can truly be as small as to be undetectable by the naked eye, to as large as volleyballs that can sometimes resemble a pregnant uterus. This is an extremely common problem, such that it's estimated that 15 to 75% of women will have fibroids during their lifetime.
Really? And can people go an entire lifetime with these fibroids and never know it?
That is correct, yes. And not all fibroids are symptomatic. So there are a lot of women we can simply just observe and watch as long as their fibroids are not creating any bothersome symptoms for them.
Okay, how does this affect one's pregnancy?
Well, pregnancy can be an issue. Women can get pregnant with fibroids. The fibroids that we're going to be most concerned about are the fibroids inside the uterine cavity. Those are referred to as submucosal fibroids. Oftentimes, they can be responsible for a lot of heavy bleeding. But in terms of fertility, they can sometimes interfere with the implantation of a developing embryo. During pregnancy itself, though, these fibroids can sometimes undergo growth and sometimes cause some discomfort during pregnancy, and can also affect the delivery in terms of maybe increasing a risk for cesarean delivery or sometimes having preterm delivery as well.
Really? So how can one avoid it? Avoid getting these fibroids? Is it something your body just creates on its own?
Yeah, so basically, fibroids are extremely common. As I said before, 50 to 75% of women will have fibroids. It's a problem that occurs as women get older. So a large amount of women have fibroids, but not all of them are symptomatic. So you really can't avoid them. Family history is an important factor. Women who have first-degree relatives, such as mothers or sisters with fibroids, are going to be at an increased risk for fibroids. African-American women actually are predisposed to having fibroids as well. And lifestyle changes such as diet and being overweight can also influence fibroid development.
Okay, so if one is out there and they maybe suffer from this or they have pains down in the uterus, like, I need to get in and see if this is a problem. Well, what can they do? What are the options?
Well, typically the most common symptoms are going to be related to pressure on the bladder and bowel, causing frequent urination, constipation, heavy bleeding. So for women experiencing these symptoms, the first thing she needs to do is to go see a gynecologist. At that point, a thorough physical examination will be done. Imaging studies such as ultrasound and MRI can also be used to determine the size, the location, the number of fibroids. And at that point, you can discuss the various treatment options that are available.
But don't be alarmed right away, right?
No,
if
not
you have
to be
some
alarmed.
pain.
Yeah, as I said before, 99% of these are benign. So this is a non-cancerous issue. It's really more of a situation that can be disruptive to a woman's lifestyle function.
Okay, and to get them removed, what is that process like?
Well, fortunately, today we have a lot of minimally invasive options available to treat fibroids. Minimally invasive meaning that they have shorter hospital stays and quicker recoveries. For a patient who's looking to maintain fertility, who wants to maintain her childbearing options, a myomectomy is probably the procedure of choice, where you can actually remove the fibroid and keep the uterus in place. Fibroid embolization is another alternative option that's provided by our colleagues in radiology, where they can actually inject particles into the blood vessels supplying the fibroids, and that helps to reduce the blood flow to the fibroids, allowing them to shrink in that manner. Hysterectomy still remains to be the most definitive option for fibroids, and that's typically reserved for patients who are done with childbearing and who really are having a lot of disruptive symptomatic fibroids. If fibroids are relatively asymptomatic, then you just simply observe. You don't have to do anything at all.
Yeah, but like you said, looking at your family history and
Family
knowing
history
this
is
is
very
something
important.
I need to be aware of,
Exactly.
right? So you can.
No question.
Let's flip the pictures one more time because I thought those are interesting.
Sure.
And I want you to sort of talk to us about what we're seeing here.
So if you look at the diagram there, fibroids can have 3 different locations. They can be on the outer portion of the uterus, which we refer to as the subserosal fibroid. They can also be involving the muscle of the uterus. We call those intramural fibroids. And those are the fibroids, they really create more bulk-like symptoms, causing pressure in the pelvis, pressure on the bladder, pressure on the bowel, leading to issues related to frequent urination, urgency of urination, constipation, painful intercourse. The fibroid inside the cavity is referred to as a submucosal fibroid, and that's typically the one that creates more bleeding issues, okay? And that's the one we refer to as earlier as causing problems related to pregnancy or implantation of the embryo.
Bleeding internally or externally?
Bleeding, heavy menstrual bleeding, okay?
So during your menstrual cycle?
Menstrual cycle, they become very heavy, very explosive type cycles. Patients complain of having clots. They have more frequent bleeding. Therefore, that leads to anemia. And actually, those fibroids are probably the easiest ones to treat surgically because we can use a scope that goes into the uterine cavity called a hysteroscope, and we can easily resect those fibroids away, and that can be done on an outpatient basis.
Do the fibroids lead to heavy cramping during the menstrual cycle?
They can, yes. So then, of course, they can cause a lot of spasm with the uterine muscle. We call it myometrium. Again, the uterine muscle is really what contracts when women are in labor, okay? So fibroids cause a distortion of that uterus that can sometimes lead to cramping, and also passing large clots can also lead to cramping.
I think every woman out there, you hear these things, you're like, I think I have that. I'm sitting here like, you know, you always think you're one, so you go to the doctor, go to OBGYN.
And that's the most important thing. I think as women, as long as we stay proactive, get in to be seen and evaluated in a proper manner, the more important thing is that treatment options really have to be designed, individualized to the patient based on her needs and her symptoms.
Yes, thank you so much, doctor.
Thank
Again,
you.
welcome to Las Vegas.
Appreciate it. Thanks
Love
again.
having an educated man here, right, to help the women. Well Health Women's Specialty Care has the staff and treatment options to help you if you're suffering from fibroids. They have multiple locations throughout the valley. To find out more, just call the number or head to the website you see right there on your screen.